Welcome to The Explainer. Today, we're diving straight into the latest ASCO guidelines to help cancer survivors, caregivers, and clinicians tackle a remarkably challenging side effect, chemotherapy-induced peripheral neuropathy, or CIPN for short. Surviving cancer? It's a monumental victory, no doubt about it. But for a lot of patients, a lingering, painful battle remains long after the actual treatments stop. Imagine fighting for your life, finally ringing that bell to signal the end of chemo, only to realize that those life-saving drugs have left your hands and feet constantly burning, tingling, or just completely numb. Well, that is the reality of CIPN. To get a handle on this, we're going to follow the patient journey today. First up, we'll look at what this condition actually is, then we'll face some hard truths about prevention, talk about managing symptoms right in the middle of treatment, and finally, look at proven post-treatment solutions.
All right, Section 1. What exactly is chemotherapy neuropathy?
We are grounding everything today in the newly updated clinical practice guidelines from the American Society of Clinical Oncology. They've combed through hundreds of recent studies to give us the absolute best, most up-to-date evidence on how to handle this. And right off the bat, you gotta know it's not a one-size-fits-all reaction. Paclitaxel, for instance, often triggers profound body pain, usually in the torso or hips, that peaks just a couple of days after a dose. But oxaliplatin? That's a totally different beast. It creates an intense, immediate sensitivity to cold. Literally, we're talking about severe discomfort just trying to swallow a cold drink, along with some really nasty muscle cramps. Oh, and for folks on oxaliplatin, there is this incredibly frustrating thing called the coasting phenomenon. Basically, the nerve symptoms actually get worse for 2 to 3 months after the chemo completely stops before they ever start getting better. I mean, imagine the psychological toll there. You think you're finally done with treatment, and out of nowhere, the side effects aggressively ramp up. Chronically, this pain settles into what clinicians call a stocking glove pattern. It's exactly what it sounds like. Numbness, tingling, and pain starting at the very tips of your fingers and toes and creeping inward. ASCO highlights that this is primarily a sensory issue, not a motor one, but it can still be a debilitating problem for literally years. Okay, let's move on to Section 2, the truth about prevention. I've got to be completely blunt here. Despite all the wellness blogs or internet forums you might stumble across, the ASCO guidelines give a massive warning against using acetyl-L-carnitine for prevention. Seriously, the long-term clinical data shows this supplement actually worsens nerve damage over a 2-year period. It actively does harm, so skip it. And honestly, the do not use list doesn't stop there. People try all sorts of things preventatively: vitamin E, omega-3s, even heavy-duty drugs like gabapentin or venlafaxine. But the systematic review? It found absolutely zero proven benefit for preventing CIPN with any of these. The guidelines are crystal clear. They should not be offered for prevention. So, looking right at the expert panel's bottom line, there is no magic pill to prevent this condition. Because of that, clinicians really have to assess a patient's underlying risks up front, like do they have pre-existing diabetes or a family history of neuropathy, before even starting neurotoxic drugs. Right now, prevention is basically about risk assessment, not some preventative force field. It's not all doom and gloom, though. While we don't have preventative pills, some surprisingly low-tech physical interventions are showing real promise. Things like wearing frozen gloves and socks, which is called cryotherapy, or doing specific exercise therapies during treatment actually show potential to curb symptoms. Now, ASCO does carefully note we still need larger definitive studies before these become official standard of care, but they're definitely on the radar. Which brings us to Section 3, managing symptoms during treatment. When neuropathy hits hard mid-treatment and causes functional impairment, you can't just grit your teeth and power through blindly. This is where patients and doctors have to take control. You've got to assess the impairment and then seriously discuss delaying a dose, reducing the dose, or even stopping the neurotoxic drug entirely and swapping it for something else. And yeah, that creates a super delicate clinical balancing act. You're having deep, sometimes really tough conversations about the intent of the chemo. Are we aiming for a minor bump in survival time or a major curative intent? You have to weigh that directly against the risk of permanent, lifelong nerve damage. The patient's perspective here, absolutely paramount. All right, final section. Section 4, proven treatments after chemotherapy. If you take nothing else away from this explainer, remember this quote. After reviewing all the literature, ASCO concluded that duloxetine stands entirely alone. It is literally the single pharmacologic agent with robust enough clinical evidence to back up its use for treating established, painful CIPN,
period. When you look at the trial data, patients on duloxetine consistently showed a significant decrease in numbness and pain compared to placebos. But let's keep it transparent. The guidelines do point out that while it's the only recommended drug, the overall amount of benefit is still somewhat limited. So it's a great tool for sure, but it might not be a 100% total cure for the pain.
Because the drug options are so limited, the hopeful future here is really leaning into physical medicine. There's some super exciting preliminary evidence for things like guided muscle strengthening exercises, acupuncture, and scrambler therapy, which, by the way, is a fascinating type of electrocutaneous nerve stimulation. These interventions might significantly alleviate chronic symptoms. They're safe to try, and they hold a ton of promise. We have covered a lot of ground today, from the strange ways different drugs attack our nerves, to the harsh realities of prevention, and finally to duloxetine and promising physical therapies, which leaves us with a pretty vital question to think about. As science finally starts moving beyond just relying on pills, how will these targeted, non-chemical interventions redefine what a truly pain-free life looks like for cancer survivors? Thanks for tuning into this explainer, and keep learning.